Review of sleep medications. First class, benzodiazepines. They all end in PAM. Clorazepate, chlorodiazepoxide do not. Commonly used ones. Brand name, Restoril, temazepam. Another one, Halcyon, triazolam. Dalmane, flurazepam. Another one, clonazepam, Klonopin, Ativan, lorazepam, alprazolam. The only difference is some last longer, some last shorter. So if you use a long-acting one like clonazepam, Librium, those drugs tend to give you a hangover in the morning. So you want a short-acting one like temazepam, triazolam, or another one, alprazolam. EL, not AL. These drugs develop tolerance. You need more and more of the drug over the time. They can have withdrawal syndromes. They interact with alcohol, and they're controls. That's class 1. You could see why I don't use them. They're synergistic with alcohol. You could overdose. Habit forming, tolerance develops. You don't want to use them long term. Class 2, benzodiazepine-like drugs. These drugs give you the sleep qualities like a benzodiazepine, but do not have the anti-anxiety effects, and I would say dramatically less addicting. They're all short-acting. Ambien, Zolpidem, Lunesta, Azolpiclone, Sonata, Zalplan. So those 3 drugs are benzodiazepine-like, but not really benzodiazepines because they only stimulate one subunit of the GABA receptor. Go to my benzodiazepine lecture and you'll get the gist on that. These are commonly used. Less problems with tolerance, less problems with addiction, dramatically less. But they still can interact with alcohol, but less than benzodiazepines. But yes, tolerance can develop and the dependency on these drugs can develop. Class 3, antidepressants. An old one is Elavil, amitriptyline, used for sleep. Has a lot of those nasty side effects of dry mouth, blurred vision, constipation, urinary retention, dilated pupils. Silnor is Sinequan in very low dose. It's like 2.5 or 5 milligrams, something like that. It's also called Doxepin or Sinequan. Another one is Trazodone. It's also known as Aleptro. That can help you sleep. These drugs can be of help. They're just a different way to put someone to sleep. The next class would be Antihypertensives Clonidine. It's used in drug withdrawal, but it can be used to help put people to sleep. Clonidine works by the body's fight or flight response and blocking it. Other drugs in this class, atenolol, propranolol, carvedilol, they can all make you sleep. They're not great, they're not indicated for sleep, but I've used them for sleep. The next one would be orexin drugs. Belsomra was an orexin 1. Didn't work so well. I did a talk on Dayvigo is lemborexant, which blocks orexin 1 and 2. Works better, not great. The next ones are antihistamines. Remember diphenhydramine? That's Benadryl. It's over the counter. Sominex. Unisom is doxylamine. These are antihistamines with anticholinergic side effects that make you sleepy. Promethazine makes you sleepy. That's Phenergan. Meclizine, Antivert, makes you sleepy. It has to do with this. It blocks acetylcholine in the central nervous system. Hydroxyzine, they're all right. Doxylamine and diphenhydramine are the ones over the counter. Unisom is doxylamine. Benadryl, they have Motrin PM, Tylenol PM. They have diphenhydramine in them. These drugs can cause memory problems, dry mouth, blurred vision, constipation. They don't work that great. They put you to sleep, but the next day you feel hungover. And what else? You just have a lot of side effects. Memory problems, dry mouth, blurred vision, constipation. The next class of drugs would be anti-seizure drugs like gabapentin, Neurontin, Lyrica. There's another one, Depakote, valproic acid. Pregabalin is Lyrica. They're not indicated for sleep, but I've used them for sleep. They're not so great. They help. The next class 7, would be melatonin drugs. Rosarum Ramelton is a melatonin 1 and 2 agonist. There's a new one, Tazimelton. Het.LLC.is. It's called. I don't think it's restricted distribution in the United States. The last class would be barbiturates, seconal, butalbital, phenobarbital. Very addicting, lethal in withdrawal, not so great. The herbs, 5-hydroxytryptophan, lavender, L-tryptophan, L-theanine, valerian root, lemon blossom, passion flower, magnesium, like Epsom salt. These all can help you sleep. Then there's foods like turkey, kiwi, almonds, walnuts. What else? Cherry juice, fatty foods, fatty fish makes you sleep. Okay. I kind of talked about 8 types of way to make you sleep. The best herbal supplement out there is probably melatonin. 3 to 5 milligrams, maybe 10. So here's the problem. Oh, another antidepressant that I meant to talk about was Remeron, mirtazapine. So mirtazapine, Trazodone, and Sinequan are the antidepressants that make you sleep. Mirtazapine, which is Remeron, makes you fat too, so I don't really use it that much. What it comes down to, I try simple stuff first, like Trazodone or Sinequan. It's an antidepressant that makes you sleep. They're non-addicting, minimal side effects. If that doesn't work, I maybe go to Ambien, Lunesta, or Sonata. If that doesn't work, I may add a benzodiazepine, temazepam, lorazepam, clonazepam. You may have to mix the non-benzos like Ambien, Lunesta, and Sonata with the benzos. You may have to add an antidepressant. You may have to add Clonidine. You may have to, it's called stacking. You may have to add Neurontin or Clonidine or Inderol, or sometimes I add Neurontin, or I add one of those melatonin drugs, or sometimes I add those orexin drugs like Belsomra or Dayvigo. And sometimes expense comes into play. That Dayvigo and Belsomra is really expensive. Those are the orexin drugs, the block orexin, and the anti-melatonin drugs, Rosarum, which is Ramelton, and Het.LLC.is, which is Jazimelton. Those are expensive. So cost comes into play here. You can get generic Ambien, Lunesta, Sonata, Trazodone, Sinequan, Selenor, Remeron, temazepam, lorazepam, oxazepam, and alprazolam cheaply. This is the gist of what's going on. So if one doesn't work, I use another one. Then I may use mixtures. I stack. Polypharmacy. You do whatever you have to make people sleep without having daytime side effects. That's the gist on sleep meds. Thanks.